Yeah, I think Shroff was an amazing place. You're in Dehli, which is a very crowded, busy, noisy, and in some parts very kind of a poor city in major portions of it. And then you go to Shroff, which is kind of in the middle of all this noise and commotion, and you walk inside the gates there, and all of a sudden there's kind of a different type of atmosphere. You can tell you're in the healthcare system, a healthcare part of the community. There's a lot of patients that you run into right away. You can just see when people are walking around that they've got advanced pathology in their eyes just by walking past them in the hallway.
Yeah, I think they're so Shroff's is a very academic hospital, and they're really interested in research collaborations going forward, and we were able to sit down with the faculty and talk about potential research projects, and it's just great to have open doors of communication to be going forward with them as a fellow, but also joining faculty and know that that's a potential collaboration.
You know, my dad's a surgeon, and we talked about things, and one of the things he's told me is you want to go to a program where you're going to get training and you can feel comfortable when everything goes right, but you want to know what to do when things go wrong. You want to be able to stay calm. You want to know what the next step is. And although what we learned in India, it's going to be, we may never need to use outside of this training, but you never know when that day may come, and we now have the tools, and I think that's very valuable.
In terms of differences between India and the United States, I have a lot of interest in endophthalmitis which is an infection in the eye, and how we can prevent that and how we treat it. And I've been doing a lot of literature research on how we can reduce the risk of endophthalmitis. And some of the data that we are finding internationally is moving away from using preventative antibiotics because they think that it selects for a different, more virulent strain of bacteria, and it's actually more likely to give you an infection. Whereas in India, I have such a different patient population that they're very worried about hygiene factors, and so they are more likely to give antibiotics in order to try to counteract that. And so I think that was a very different experience that we have, and a very interesting discussion to have.
So, thank you, Shroff's Hospital, all the staff, trainees, everybody who took the time out of your super busy schedules to make sure that we were at ease at home, despite the time difference and jet lag, that's real. But thank you for showing us the surgical techniques that we really had no experience, and you just put us right there and walked us through the surgeries, and so just thank you for everything and making sure that the trip was great, which it was.
Yeah, big thank you to Shroff's Hospital, all the people involved. The hospitality was incredible. We had an amazing time there, from all the training inside the hospital, and then the meetings, the dinners outside of the hospital. Overall, an experience that we'll never forget, and we greatly appreciate everything that you guys did to make it such an incredible experience for us.
Yeah, so I was able to go on this trip thanks to the generous support of donors to the Retina Fellowship Fund, and I was really grateful to have the opportunity to go. I was the first Retina Fellow, I think, ever to go on this trip, and it was really an amazing experience, and I really hope that future fellows get to have the opportunity too.
Yeah, thank you to all the donors who helped support us going on this trip. I know it's a tradition for UW, and hopefully it can continue, because it's definitely something that I think every doctor who is going to be treating and helping patients, we should step outside of our box. We should be uncomfortable. We should see what's happening outside of Madison, Wisconsin, and know that there's life outside of here, and it's a good thing. So thank you for this experience and all the support.
Thank you all to those who helped support us in this trip, making this trip possible. This is an experience that we really puts in perspective a lot of things throughout your training and life, and just to be able to do this in our residency as part of being at the University of Wisconsin adds a lot to our overall training experience, and is definitely invaluable to our growing as a person, and then growing as a medical professional. So thank you for all the support that you've given us and for making this possible.